So what is manual therapy? What do you consider manual therapy to be, right? And you want to understand your understanding versus the public's understanding, right? And that's really key because that's really going to come down to um, what people understand, right? So a lot of times people might think of manual therapy, especially patients think of it just as massage, but manual therapy includes a lot of different techniques. Some of them is called mobilization, right? Some of it is you know uh, joint mobilizations, scar mobilizations, affecting fascial, such as myofascial release. Those are all manual therapy techniques, or what would be considered manual, but it's pretty much anytime you're touching someone and you are affecting tissue. That's as simple as I can explain it. And of course there's a lot of different types, but at the end of the day, if you look at all the different types, it really simplifies down to that. But what happens a lot of times is you understand manual as being your technique as a therapist. You know, you moving the joint in an anterior or posterior position, you mobilizing that scar, doing cross friction massage. But your patients, they might just think it's massage, right? They don't necessarily understand what it is from a technical standpoint. So I think what happens is, we have a particular understanding, and I want you to have a particular understanding of what on the other side, not just what you understand or what you think it is, but I want you to have a real good understanding of the people that are coming to you. So for a moment, take a look. What stops people from coming into therapy? This is something I think all the time about, because I have a small business, I have a clinic, and I have to think about what stops people from coming to my clinic. And I want to encourage you to think about that too, because whether you work for a big clinic, you work for a small clinic, at the end of the day, you build your career off the caseload that you get to work off of, right? So have a think. What stops people from coming to therapy? A lot of times I find people think that the pain and the injury is going to go away on its own, right? That they're like, I don't even want to bother. Let me see if I can go on YouTube and get some videos. I put a lot of content out teaching therapists, and you have absolutely no idea the amount of people who, send me their own injuries. It's not even therapists, asking me, hey, Huang, what about, what should I do about this, or what should I do about that? But it's patients coming on, and saying, they're sending me pictures of their mangled hands, and they're like, do you think this will go away? How should I, you know, uh, do therapy to this? They're going on, they're watching, people are listening to their friends and family, and they're saying therapy is too expensive, it's no fun, it hurts, it takes too much time. Do you know there's people who think that therapy doesn't help? Oh, God, that hurts me every single time, right? Oh, it's like a dagger to my heart, right? The therapy doesn't help them. But you have to think, like, why? Why do they think that? People think therapy is expensive, but really, honestly, I think being in pain is more expensive. Not being able to use your hand, your arms, not being able to go to sleep is really expensive, you know? Type into the chat and you let me know what stops your patients from coming into therapy, because this is really an important concept before we move into the 5 essentials. Because in order for us to be able to do what we want to do and what we're capable of doing, we have to understand other people and what they need and what stops them coming into therapy, because that is part of the conversation, right? So type into the chat and let me know. I just shared with you all the reasons why I see people not coming into therapy. But yeah, so a lot of it is the same, right? They have a busy schedule. They think that they don't have time for it. They think it's too painful. Reimbursement. So they're thinking just about insurance, you know. And we have to, if they're not seeing fast enough results, right? Time and expense. They don't trust you. That's huge. If they don't trust you, they're not coming, right? So if they don't trust you, they're not coming, then therapy doesn't help, right? If you can't show or speak of some results, then they won't make the time and attention. And I want you to think about that because, yeah, and location too. Everyone wants it convenient. Everyone wants it. I had a patient, I had a patient tell me, "Can you just like dee, 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 and like fix my pain?" I was like, "If I could do that, I would be rich. Okay, I wouldn't be I could then program and then I could just put it into your brain so you don't have to buy in, so you don't have to trust me, so you don't have to take the time and expense to come travel to a place to learn these skills," right? People don't know what therapy really is, and some people look at it as just exercises. Hallelujah. That is always what happens, right? So it really does come down to us being one person that explains over a period of time so that more and more people understand, right? We're coming in, I'm going to AOTA soon, and everyone's like, "Oh, OT, OT," and are wonderful and great, but we need to stop talking about us like OTs, and we need to start explaining to people therapy, like about therapy and how therapy can help. So I'm a firm believer in high tide raises all boats, right? High tide raises all boats. So I'm not going to just help, one person and think nobody else will get help. I think, like, if we all level up our skills, you don't have to. I think a lot of people think of me as like, oh, you can only come to Huang's classes or to her online classes and stuff like that if you want to become a certified hand therapist. But I actually really, truly believe in high tide raises all boats. And I think that if we as therapists in general, like OTs, OT assistants, PTs, PT assistants, CHG, whatever, if we all show up to show to our patients what is possible from coming to therapy, then more and more people will start to believe. But it really starts with one person, and it starts with us, right? So here are some of my reasons, and you guys gave such great reasons why manual therapy is important. It definitely, in my experience, I'm just sharing with you my experience here, it has definitely helped my patients get results faster. I personally love working with post-surgical cases, and I think that you can't work with post-surgical cases without having a certain amount of manual therapy skills. And I include wound care in with manual therapy skills, even though from a technical standpoint you would bill it differently. You would bill it under wound care. But in order to work with wounds, you have to know how to touch and how to position and how to adjust your touch, right? And at the end of the day, people love it. People love, even though they might think what you're doing is massage, people love it. There is that important connection of touch and connecting with people. I always say when, as a hand therapist, I get really close to my patients, and my patients actually develop a lot of information because I'm literally holding their hands like the whole time, or I'm just like so close because I'm up on their elbow or shoulder, right? And at the end of the day, this manual therapy skills helps to ensure that you're not easily replaced, right? I don't care if there's therapy guns, if there's massage chairs. Those are very unspecific. If you learn other tools or modalities, they are, they're trying to replace therapists with TENS units, ultrasounds that you can just order. Insurance companies are sending them to people's houses. They are creating quote unquote home exercise programs that the patients can just do on their own. But the reality is, humans, we all need some form or fashion of accountability, right? We all need a little bit of help to kind of get us going and pushing us in the right direction. I mean, why do you think people join, clubs and classes and, get personal trainers or get people to cook for them healthy meals so they don't go out and get, chicken tenders and fries, right? But these skills, when you develop them as a therapist, manual therapy skills cannot be replaced. And I often talk about OTs developing their skills so that you can have more choices. This is it. Manual therapy skills plus critical thinking has always given me more choices in my career. I've been able to switch jobs. I've been able to stay in positions that make me happy, that give me fulfillment, and not just because I had to. Right? I've been able to grow a clinic, a therapy clinic, an online program. Like, I think the possibilities nowadays are just completely endless in terms of what you can do and how you can advance yourself, right? And so these are why manual therapy skills are important for me.